Hello, good evening, neighbors, friends, and brothers and sisters. Welcome. This is your member provincial parliament, Faisal Hassan, and tonight we're having a town hall meeting on eye care. First, before I begin, I wish to acknowledge at this time the land that we now know as York South-Western is a traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations and Inuits and Métis people. Hello, everyone, and thank you for joining us for this important discussion on eye care in Ontario. Optometrists have withdrawn OHIP insured optometrist services after a breakdown in negotiations with the provincial government around fair compensation for their services. For months, they have been urging the government to come to the negotiation table to ratify the historically and fair compensation they are receiving from the government. I recognize how important these services are to so many in our community. The valuable work of optometrists helps seniors and children maintain a healthy quality of life and ensure preventative care for our children. The contributions of optometrists to our healthcare system cannot be overstated, which makes their treatment at the hand of the government all the more disappointing. This evening, I am joined by local residents affected by the disruption, as well as the local optometrist to discuss the issue and its impact on our community. I am pleased to be joined by Dr. Heather Shear, optometrist, and also owner of the Northwestern Eye Associates, and also shortly, and also Louise Giacometti, local residents have joined as well, and we're expecting shortly others to join us, such as Janine Robinson, local residents, and Lesbeth Mendes, and Oli Powell, and also Michael Bayer. And hopefully we are expecting them to join us shortly. I will welcome my guest and also welcome you, each and every one of you who are joining us on Twitter, on Facebook, and also YouTube and Instagram as well. Welcome. And I would like to welcome Dr. Heather I know that you have been doing so much work, important work needed for our seniors and our children in our community. First, we want to thank you for the work that you're doing in our community, but also tell us also the challenges you have as a doctor, an optometrist in our community.
Well, thank you so much, Mr. Hassan. Before COVID, we had 4 doctors working at once because we have 4 exam rooms in our office. We had 4 patients an hour coming in the office, and we could process a lot of patients. And, we're managing glaucoma, diabetes, age-related macular degeneration, so many conditions that affect the eyes and the vision and the ability for people to live and work in productive ways. And now with COVID, we had limited for 2020, we were shut down for 3 months. We were not given by the government codes like the doctors were given. The doctors are given billing codes to allow them to do phone consultations and get paid for it. We didn't have that. They wouldn't allow it. They said that the patients could go to their family doctor and get these conditions treated, where you can't treat glaucoma over the phone or even not seeing the patient. So that was very frustrating. And then now back to work, we are seeing 2 patients an hour and only having 2 doctors in the office at a time. So with the remuneration that we're getting, or the money that the government's been giving us to pay for each exam for patients to come in, I can't pay the overhead. I can't pay my staff. I do not have enough money. And really, this problem has been going on for 30 years. We have been trying with every successive government to go forward and get the proper payment, or at least a situation that we could move forward with, where we could potentially balance bill, or some situation that was going to work and make sense for the rate of inflation. But sadly, nothing has come about.
Well, thank you very much for updating us on the crisis at the moment, and also local residents. Luisa Giacometti is also joining us, but also to give you a preview, folks, to understand where we are at the moment. In 1989, the Ontario government paid 39 and 15 cents to an optometrist for a single eye exam. Since then, that figure has increased on average 17% a year. Ontario optometrists to provide over 4 million OHIP insured eye exams a year, making up over 70% of the patients an average practice. Ontario laws make it illegal for optometrists to accept director payment or alternate health insurance from OHIP insured patients. Ontario physicians are the second highest physicians in all of Canada. Meanwhile, Ontario optometrists receive the lowest compensation rates across the country. An independent study commissioned by the Optometrists Association of Ontario found the average cost to provide an eye exam in Ontario was $75 to $75.51 in 2019. And in 2004, just to give you a background, what happened, the Liberal government delisted routine eye exams from OHIP. Others affected by the withdrawal of the services included people who receive social assistance through Ontario Works or Ontario or DSP, and those with specific OHIP covered conditions like diabetes or retinal disease. Optometrists are finding it difficult to keep their doors open and pay staff decent wages because of the lack of government reimbursements. So this is basically where we are in a nutshell. I want also to welcome Luisa Giacometti, who's also an active member of the community and who's also a resident. And how does it affect you, Luisa?
Well, as the doctor has pointed out, every single time I go to my optometrist, I'm putting out a lot of money out of my own pocket, a lot of money. And, but what especially concerns me, especially in our area, your riding as an example, is the fact that a lot of people that don't have the money, their condition will only worsen. And when it worsens, like this whole thing about, you go and see your family doctor. Well, you're not going to go to your family doctor, let's say if you've got cancer, and they send you to a specialist? Well, optometrists are specialists in their own field. You can't, that is such bogus thinking. And that's what bothers me, because what's going to happen is it's going to cost the healthcare system 10 times as much down the road for stuff that is not being diagnosed at an early stage, because once you do it at a later stage, it's too late. People become blind, people don't see properly, so then they can't work properly, and on and on. Like, it doesn't make any sense to me. That's what bothers me, from the Liberal government right into the Conservative. And then again, you've got optometrists that have less work. So, it's this vicious cycle, vicious. And people are putting out a lot of their own money if they can afford it. And if they can't, then, they're going to get into this predicament where even if they go to their family doctor, it may be too late.
Absolutely. That is also, I also, my family has a history of glaucoma, and I have met many constituents who have called me phones and emails, and this is a crisis, and this government has to do something. We can't wait any longer, and we can't wait crisis to happen. People to lose their sights. And that becomes very difficult for us. Folks who are joining us on Facebook and Twitter and YouTube, and also those who are joining also on Facebook, will be happy to take also your questions and share your comments. So stay tuned as well. We will be welcoming your questions and your comments as well. So feel also engaged with your comments and with your questions as well for our guests. And of course, we're also expecting other members of the community who said that they're going to join us. And as soon as they join us, will be also to want to share their stories. Some are also, who have had problems with eye issues at the age of 17 and continues to have them. And they're relying on, these are also seniors and also most vulnerable members of our community, seniors and children as well. And I also welcome, Dr. Heather. I know that the government is putting the optometrist in a very difficult situation. Because the government have a responsibility to act rather than just playing. I had an opportunity last week to ask a direct question, a Minister of Health, and she was just basically wasn't very helpful at all. And my colleagues also have been asking questions, just come to the table and work with the optometrists so that we help members of our community. And how do you feel the government is responding to the optometrist?
Well, Mr. Hassan, they met with us for 2 days of negotiations, and they played games, and they left us in, not me personally, but the members of the Ontario Association of Optometrists were there, and they left them in a room for 8 hours, and it was a virtual room, but in a room for 8 hours, waiting for them to come back. And then they came back with no negotiation at all. They just said, this is what you're going to take, whether you like it or not. And the answers that the minister is giving are just not appropriate. And Louisa hit on the head the exact problem. Everything is going to cost more later when these problems, lead to blindness and people can't work. People who have perfectly good ability to work and live and have good lives they're gonna ruin their lives by letting these things fester. And the ministry is not addressing these issues at all. They are playing games. They really are.
Absolutely. And it's not this is not the time to play games. This is time to lead and provide a service for the most vulnerable members of our community. And we've seen these cuttings, and we can't continue these cuttings. We need action. Louisa, I know that you also have neighbors and friends in the community who are seniors. I know that you're also involved with our seniors in our community. And this is also a service that's needed the most. And why this is happening now when we are in the middle of a pandemic where people cannot, where they need help at the moment.
So what are we doing in this community, Faisal? Are we doing petitions? Maybe we should start, like with Mary Chiavarina, who's, got that seniors group. Maybe we should start there. Maybe we should start with the TCHC tenants who, they're going to be most at a disadvantage as well. There's lots of people in our community groups that maybe we should start these major petitions to help out, the NDP, the opposition, to make some more waves in the paper. Because you see, the thing is that this particular government will always put the medical profession, doesn't matter which of the many branches, as if they are the privileged, they already get a lot of money. What are they complaining about? They frame the situation in such a way that it's their fault and they're just complaining, and that people should just be grateful for whatever they have. And there's just no money in the kitty to do anything else, which again is a bogus argument. But nevertheless, that's how it's being presented in the newspapers as well. And the thing is that, we have to start, especially in communities like this, to turn it around so that, you know, like, I wish tonight there were a lot more people on this particular webinar so that, you know, they could hear the actual issue, so they in turn could be talking to friends and whatever, and get involved more. And you see, if people don't get involved, but people are tired. COVID has made them extremely tired at this point. They're fatigued with all of the vaccines. They're fatigued now. It's supposed to be a flu vaccine. They're afraid that, you know, there could be more COVID outbreaks. So the thing is that people aren't focused, and this is what the government is banking on. They're banking on the fact that they're not really paying attention to this because there are so many other more important distractions at this point in time. But maybe, Faisal, as I'm suggesting, is maybe we start with the established groups in our area, and that way it gets disseminated down and explained, and we can get these petitions in to you, so you in turn can present it in the House and also to the media.
Absolutely. The optometrists in our community have delivered to me hundreds and hundreds of petitions, and we've already tabled them. Okay. And my colleagues have been doing that as well. And I think what we need to do is this government immediately to act and to deliver for the people, because we can't allow many seniors who rely on these services to simply lose their eyes. And when that happens, then who's going to support them? You know, now is the time to support them.
But this government's not going to do it though, Faisal. That's what else can we, what pressure points can we put on? Right now, they're not interested. They've got the long-term care. That's their big announcement. That's what they're doing. They haven't done anything beyond that. And what is the real issue here? Is it the money? Is it X amount of millions that will go out per year? Is that what they're really concerned about?
I can answer that.
Yes, Heather. Yes, thank you, Louisa.
So one of the problems is because the optometrists have not been paid per visit appropriately. Over the years, every time we've tried to negotiate with governments, they've said, we're going to set up, we're going to set up a work group and work with you and try to figure out what the correct amount is for each eye exam. Right. And that was just smoke and mirrors so that they could push it off until they either got reelected or another government came in. And so literally for 30 years, this has kept going on over and over and over again. And really it was COVID that put us to the edge, because now, like I said, we're working and seeing half the number of patients. And so, yes, it is about money, but ultimately it's about care, because the care that people are receiving is higher level care. So 30 years ago, when you walked in to get an eye exam, we would check the eyes and we would give you a prescription. We would look inside and we'd say, oh yeah, everything looks fine. But now we're using technology that sees like all the way down to the 10 layers of the retina. We have, so much technology that can help us diagnose disease. And with that technology is money. It's expensive to bring these instruments into the office. I just bought an instrument that was, $50,000, and I'm paying the bank back to pay it off. So with all of those extra costs, we need to find going forward the ability to, to see patients, give them the quality of care that they deserve, and be able to pay the bills. And I will say that the government came out, in that negotiations that lasted for 2 days, they came out and said, okay, we're going to pay you $39 million for 10 years of lack of care, like lack of fees. And that wasn't even what the optometrists were asking for. We don't want to talk about what happened 10 years ago. We want to talk about going forward. We want to go forward and have something that's sustainable and have an agreement with the government that says, okay, you're going to put our fees up to whatever amount, and then every year going forward, you're going to get an increase. Right now, the increase that they offered us was 8%, which is really about $4, almost $5 for the visit. It just doesn't match what the cost is. Like Mr. Hassan said, the cost was $75. That is, that's still the lowest paid in Canada. That still puts us, at least $2 lower than Manitoba, which is the next province to us in terms of how the doctors are paid. And it costs a lot to live in Ontario. So, so these are the issues going forward. Yeah, those are the big issues. Yes, it's money, but it's a little more complicated than that, but it is about money. Yeah.
Absolutely. And I think the government have a responsibility rather than cutting, because eye care is health care. And we've seen that it affects the health. And that's why we need to get a resolution quickly, and we need this government to do the right thing. And definitely we will pressure down, we'll continue to do that because it's the right thing to do. And folks, you have just heard, Dr. Heather and also Louisa, who's also a local resident, those who are joining us on Facebook and Twitter, and also YouTube and LinkedIn, welcome. And we'll be happy to take your questions as well. And quickly, here somebody at Twitter says, even optometrists get more money from OHIP for doing a refraction like $50-something. I mean, that is not, that's nothing. And folks, so your questions and comments is welcome for my guest tonight. And we're also expecting other local residents who affects this also might join us. As soon as they join us also, we'll be happy to share, to also share their stories. And quickly, March 30th, 96% of Ontario's optometrists voted to stop performing OHIP coverage eye care services starting in September, unless the government agreed to binding negotiations. August 17, Health Minister Christine Elliott announced a proposed lump sum payment of $39 million to Ontarians, roughly 2,500 practicing optometrists, which the ministry says would cover a retroactive period over the past decade. September 1st, Ontario optometrists stopped providing eye care to all patients covered by OHIP. September 27th, the official opposition called on Ford and Conservatives to restore children's and seniors' vision care urgently. My leader, Andrea Horvath, called on Dartford government to immediately get back to the table with optometrists and put fair funding in place to give children and seniors the eye care they being denied. Government underfunding and a refusal to negotiate has caused all eye exams covered by OHIP to stop on September 1st, which means no one under 20 years old or over 65 years old can make an eye exam appointment, even if they have insurance. October 5th, Ford must insure. One of my colleagues have also asked question at the legislature, and also I have also asked on that week also and tabled petitions as well, and continued for us to fight. And that was also my colleague Jeff Birch asked Ford must ensure eye care services resume immediately. Despite months of advance notice and years of building problems, the Ford government is refusing to work out a deal with optometrists, leaving the eye care of Ontario families in the lurch. Eye care is health care, but in Ontario right now, no one under 20 or over 65 can receive an OHIP-funded eye care, even if they have insurance. October 6th also, my colleague, my leader actually, Andrew Horvath, asked the leader, stop denying children and seniors badly needed eye care. Eye care is health care. The Liberals underfunded and used the listing to cut vision care. Now Dartford has made it worse, and kids, seniors are paying the price. New Democrats want to stop advocating for kids, teens, and seniors to get the vision care they badly need. And myself also urged Ford to act on October 19th with urgency in restoring eye care in our community. And my office has been flooded with letters and calls from families whose children and elders are suffering right now from no access to vision care. And we know also the Liberals delisted routine eye care exams from OHIP back in 2004. And now the Ford government is continuing that legacy of cuts, leaving optometrists in Ontario to trail the rest of the country in receiving fair compensation for their professional services. And those who are also joining us I will just say quickly before I come to Dr. Heather. Another person from eye care, I think it says eye optometrist, says, I mean the eye specialist, not the optometrist, for the 50 something dollars. They shouldn't be making more than optometrists for their own job. I don't know the difference between that. Maybe Heather could explain to that. Dr. Heather.
I'm sorry, I didn't, what were they asking? They were
She
saying,
was saying, I think saying that previously said this comment, even optometrists get more money from OHIP for doing, I think meant ophthalmologist, yes, get more money from OHIP for doing a refraction like 50 something dollars. I mean the eye specialist, not the optometrist.
oh, I see, like the ophthalmologist.
Yes, yes.
So ophthalmologists, number one, ophthalmologists are medical doctors, so they're under the medical umbrella, and they get paid a little bit differently. They also get paid per the service they provide. So refraction, so doing the prescription is one payment that they get. I believe the full exam is $80. They get paid to check eye pressure. They get another $5 for that. Trying to remember what the other, there are certain procedures that they can do and they get paid extra for it. The expensive technology that I was talking about, they also get paid to provide that technology as well. So that's extra on top of that. So it's over $100 that they get paid for their complete eye exam. Yeah.
I see. So you see, folks, this is also an update exactly how our optometrists have been treated, and we need action, an action which will also allow our most vulnerable members of our community, seniors, and also our children who are, the ages lower than the 20 years age of 20 years old and over 65 years old, folks, members of our community. I know, Louisa, I know we also invited another 5 members of our community who have said that they're going to join us. As soon as they do, we will be able to also share their story. I know that also Louisa, I know you've talked about, the importance of government providing the services necessary and the care. But we need, of course, next year we'll have an election, of course, in June 2nd. And if they don't provide it, definitely 6 months, it's a long time though. I mean, it's close to now what happens. I know my family, my own story of my family, some members of my family have had a history, they didn't know that. And now they cannot even see because of, it has to be detected before it hits you, especially glaucomas. And now these people have been doing these routine testings continuously. So what options do they have, Dr. Heller? Folks like that.
So there's no testing, there's no eye exams, nothing at this point, even if you pay out of your own pocket?
You're not allowed to pay out of your own pocket. It's illegal for us to accept payment. If the patient is covered by OHIP for the exam, we're not allowed to see them.
Wow.
And that's so. What is this? Is not right. And I think we need this government to act immediately and urgently, because this is serious. And definitely, as I go back this week, I will be also trying to also, and my colleagues also will do to also pressure them more to make sure these services are delivered for members of our community and also across the province.
Absolutely. I will tell you that ophthalmologists are still seeing patients. However, now with the optometrist not seeing those patients, the ophthalmologist waiting list has now, skyrocketed. So what would normally be a 6-month wait could be a year to a year and a half before a patient can be seen. So there will be delays for sure.
What
And
about
the
cataracts?
ophthalmologists don't want to do refractions. That's the last thing they want to do.
So cataract surgeries, not,
Those are still going. The problem is the people who refer patients for cataract surgeries are the
Right.
optometrists. So if they're not getting in to be seen by the optometrist, then
Right.
they're not getting sent to the doctor to do the cataract surgery. So
That's what I
Um,
thought. So
yeah.
that's another huge problem.
that is another huge problem. The ophthalmologists, yeah.
Well, folks,
Actually, it's
those who
quite
are,
disgusting, this whole thing. I'm surprised that it just, that's even allowed to go on. I'm just flabbergasted by it.
It's
honestly.
crazy because Louisa, I will tell you that the optometrist told the conservative government that discussions need to go on way back in I think they spoke a little bit in August, and then they said we're going to stop seeing patients in September, and there was no communication. Actually, between December 4th of 2020 and August 5th of 2021, there was no communication from the conservative government.
This is how the conservative government, though, usually behaves. That's how they deal with things. They just ignore it or they shut you down. And that's pretty sad.
well, thank you, folks. Those who are joining us, you're joining your member provincial parliament, and tonight we are having an eye care town hall meeting, and my guest is Dr. Heather Shear, a local optometrist, and also the optometrist and the Northwestern Eye Associates, and also a local resident, Luisa Giacometti. And those also, I would just like to take a quick comment from folks who are joining us on Facebook, and Susan Leet and others who joined us. Thank you for joining us tonight. And it says that the government is stonewalling. And that is exactly what the government is doing. And folks, bring your questions and comments. I'll be happy to share my guest as well tonight as we talk about these important issues that's affecting eye care is healthcare, and we need to address this immediately and to bring the attention to this. And if you are joining us, please reach out to your member provincial parliament and tell them to pressure the government and the Minister of Health and the Premier so that we get results of ASP. And welcome, folks, also those who are joining us on Twitter and YouTube and LinkedIn. And we are also trying to incorporate your comments as well and to hear what you have to say on these issues. And if it's affecting you and your family, also share your stories. I'll be happy to hear those. Luisa, you were saying something before I interrupt you?
What was I saying? Sorry.
Yeah, you were saying something earlier about probably you were talking about these conservative government that is just stonewalling. Of course, our
the thing is, I will, once I get off of here, I will write directly to the Minister of Health as well as the Premier. And I mean, you said a lot of petitions already. Just more people, the better. So, you know, it's just disgusting. I cannot understand. I mean, first of all, they blew long-term care. Okay, so now they're doubling back and they're trying to make up for that, and it's still not good enough. And now there's this and that. They hope that will go away, but it's not going to go away. The province also needs dental care better than it is right now. That's kind of, you know, not here or there. You know, our whole healthcare system needs to be revamped because there are certain, you know, our diseases are changing over time. So like even with this COVID, you know, you look at preparation, you look at staffing, you look at everything, right? It needs to be revamped in order to be ready for a lot of this stuff. But like you pointed out though, Faisal, we're becoming an aging population, right? Yeah. And aging population, no matter what you do, even if you go and see the optometrist on a regular basis, the eye changes. You know, the glaucoma, the cataracts are one of the #1 things that happen. But then there's all sorts of other eye diseases. And, the thing is, they're saying, to stay at home, right? You live at home. It'd be best if you stayed at home as you age, right? But how can you do that if you've got all sorts of eye problems and other health problems, and because they're not being addressed at an early stage? It just becomes this catch-22, And so
Absolutely.
then healthcare costs skyrocket, but that's also because there's no prevention. So,
Yes. No, I think there's a lot of absolutely. You're right. We need a lot of services to be delivered, but also we need a government right now to tackle the important issues of eye care. And eye care is healthcare. I would like to also to take some comments from coming to us from Facebook. And again, Susan Leet says the government doesn't feel that optometrists are a valuable part of healthcare. An aging population is a factor. Level of care needs to increase, definitely, but also we need a leadership, a government that listens, a government that understands the important work that our doctors, the optometrists are doing in our communities and across the province. And I think that we even from now to June 2nd is a long time when we talk about eye health. A lot of people are going to be affected before even we go to an election. So it's now is the time to deliver results for our community, especially for most vulnerable members of our community. Folks, you can also share your comments and your questions, and we'll be happy to receive them. I know that Susan just said that the government doesn't feel the optometrist a valuable part of healthcare. Do you feel the same, Dr. Heather?
I do feel the same. They do not, like I said, when COVID hit, they felt that we didn't need codes for phone consultations. And I would sit in my office and pick up messages when, we weren't allowed to see any patients. And I'd have to, call back the patients and tell them what to do over the phone. And there was no payment to be made. There was no, so that was, very frustrating, and I couldn't see them in the office. So that was tough. And so if they had valued or understood just a little bit what we do, then that they would know that we are a big part of it. And just like I said before, I mean, we diagnose cataracts in patients and we send them to the appropriate doctor who can help take care of it, and they can keep going on living their lives and working their jobs. And if it continues unseen, then patients will have difficulty with their vision.
Absolutely, and it's time to say yes to eye care in Ontario. Absolutely. So folks who are just joining us, you're joining your member provincial parliament, and tonight we're having an eye care town hall meeting to highlight the important issues that many of members of our community, especially elderly and also young children, that are facing in our community. We need to make sure that eye care is healthcare that services is available to members of our community. Definitely the official opposition have been fighting. I have also highlighted what we have done to pressure the government up to date, and we need to also do more. And if you haven't signed the petitions, is there a way, Heather, the community can also join to sign those petitions to pressure the government?
Yes, there is. They can go visit a website called saveeyecare.ca, and they can sign a petition there. They can come into my office at Northwestern Eye Associates. That's at Eglinton and Weston, and we have petitions at the front desk. And those are the two easiest ways to do it.
Yes, and the easiest, I think I can give you, I think the address is right there. You won't miss it. It's on Eglinton Avenue West and Western Road, right there.
It's on Weston and Eglinton. Yeah. It's just north of Eglinton on Weston. Yeah.
Oh, that's right. Yes. So there you could then go there and sign the petitions there as well, and happy to table them as well there.
Yeah, Mr. Hassan, I was just going to say that Minister Elliott has twice said in the legislature that we don't expect, this is a quote, we do not expect optometrists to pay out of pocket for the services they provide. And yet she doesn't want to stand behind her statements, but she has said it twice.
Yes, I've also asked direct question last week when I was at the legislature, and she didn't answer my question, to be honest with you.
No, she
You know,
didn't.
and what I asked is to negotiate in good faith, you know, and instead of just blaming the optometrist, the right thing to do was to say, I am prepared to do A, B, C, D, and implement what the optometrist have asked, or come to the table without conditions. You know?
Mhm.
So,
Negotiate properly.
yeah, exactly. And
These were not proper negotiations. If these negotiations had been with a unionized organization, they would have been considered illegal.
And look at that. And this is also in the heart of our healthcare. And eye care is also healthcare, and we need to do it. And they say, you know, we are the party of saying yes, you know, but they're not saying yes to healthcare. They're not saying yes to eye care, you know, and this is the case, folks, because we can't even afford many seniors in members of our community to lose their sight, especially the elderly and young people. So who's going to help them when that happens? Now is the time to actually do that work, preventative, and to make sure that we put the resources necessary now, and also do the right thing, and also provide professional services that optometrists are providing. They should be compensated properly, and their professional services. Absolutely, I agree with that. And folks who are joining us, who are just joining us, you're joining Faisal Hassan. You're a member provincial parliament for York Southwestern, and tonight we are talking about eye care, a town hall meeting to highlight the crisis and the issue of the dispute that this government have created under the Minister of Health, Christine Elliott, and others who are not listening to the crisis that is looming, and also the effect of the healthcare for our community. And I have been flooded, as I said, with emails and phone calls, and we need to make sure that the government comes and negotiates in good faith. And we don't want next week, when members of the official opposition asked directly to negotiate in good faith, we want the government to answer and do the proper thing and the right thing to do. And if you feel the same way, please write to them and also phone them as well, so that we get moving and also get results for this as well. Let me try also to take some questions here. Or someone says here on Twitter, can the optometrist become unionized?
I actually don't know the answer to
Well,
that. We haven't yet. I don't know that we're a big enough body. Maybe we have to be more members. We're only 2,500.
Well, I think I think that's another issue. So okay, so that's another technicalities. But I think what we need to do right now is to pressure the government, you know, and make sure that the optometrists are paid fairly, and they're also provided, you know, the professional services they're providing, and also a lot of members of our community are relying on this, you know, and we need to make sure these services are there. And I said again and again, healthcare, eye care is healthcare, and we need to deliver those results. I know that an NDP government will deliver it, but the election is not tomorrow. It will be June 2nd. But we need now.
Did you know that the optometrists, what they're paid is 0.2% of the healthcare budget?
That's unacceptable.
The fact that they're stonewalling over 0.2% of the budget is
crazy. It's just shameful. Yeah, it's very shameful. It's not leadership. And you will hear the premier will say, we say yes, but now they're saying no. And again they're saying no. Say it yes to eye care and let us move on. Make sure that we solve this issue, because this is a crisis that is affecting in our community and many communities. And I'll just quickly take a comment from Facebook. Susan says, it's unfortunate that the BC members won't table petitions, won't meet with the optometrist, and some are blocking questions on Twitter.
Yeah, they've been
This,
blocked.
this is unheard.
I know.
This is unheard, you know, but so this is the kind of government we have. A government that's saying no, 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 no to most vulnerable members of our community, seniors and children. And this is not right. Well, thank you, Susan, for sharing that with us this evening. And also thank you, the others also who are joining us on Twitter and YouTube and LinkedIn and also Facebook this evening, and for joining us. Thank you. Also, you know, we still have a few minutes to bring your comments. Send us on our way. We'll be happy to share with them. And I mean, what is the explanation of the government saying that their members won't be able to table petitions, and they're blocking now folks to even talk about the issue? Louisa?
This government is in a situation fiscally where they don't want to put certain money in healthcare, okay? Because they've been caught with their pants down with LTC, all right? So a lot of money will be directed in that direction, okay? So they're then claiming, and as the doctor indicated here, if it's only 0.02% of the total health costs, it's a drop in the bucket then, a drop in the bucket. You know, even if it goes up to 1%, it's still a drop in the bucket. But to them, it's what is important, what is flashy, what will bring them more glory. And I guess eye care to them isn't that important. Although, you know, everyone's got wears glasses, or everyone's going to have problems with their eyes in one way or the other. So, you know, I just don't get it, but it's a political issue right now. It's a political football, and it's going to be an issue for the next election. The main thing is to keep the heat on between now and June, and really educate and inform people. You got to get out there and commute. Like, whenever you have your next town hall meeting, I'm sure you'll be bringing this up, Faisal. Every time that there's a community meeting, like the pumpkin parade, I'm sure you'll have the opportunity to bring that up, making sure that this petition, saveeyecare.ca, people know about it, you know, and they can do something about it. I mean, we need to do that as much as possible. And we need to keep putting heat on the government. Because remember, I mean, these are the kind of things that they can lose on.
Well, absolutely, that's right. And that's why tonight we are having an eye care town hall meeting to talk about the local. There have been a lot of members, over 300 folks the last week alone have contacted us with this issue. And some of them have agreed tonight to join us. Somehow, you know, they are not here, but we will follow up and we will be able to continue to talk about this issue. It's important that we can only have one town hall meeting, and also safeeyecare.ca. Also, there is also, you can go there as well. Thanks, Susan, for sharing. And that's where you could also do that. And definitely getting petitions, writing to the government side, pressuring continuously. I think they will be able, this government responds to pressure. We've seen it, even though they have been saying it no to most of the important issues, and always saying it no, but why can't they not say yes to eye care? You know, and because it's important services. We know that they are just following the footsteps of the Liberals, who have started to delisted eye care on HIP on 2004, and this cuts has to stop, and we need to invest our healthcare, especially eye care. Dr. Heather?
You are correct. Absolutely.
Very good. Yeah. Excellent. So folks who are just joining us, you're joining your Member Provincial Parliament, Faisal Hassan, And also, folks, later on this evening about 7, I'll also be having my coffee and tea, and bring any beverages you have, so we can also talk about other important issues of the week. This is also our number one issue of this week, because eye care is an important issue. So if you feel that you haven't had an opportunity to participate or with comments and discussions, we'll be also having from 7 to 8. I'll be joining you again to continue the discussions, to also share information and to talk about it. Louisa, I mean, we're coming to the end. What are you? What do you now think that the community? I know the community can do. Write petitions, pressure, write to these conservative members of the government and others as well, and also visiting also safeeyecare.ca. What else do you think the community can do?
They have to educate themselves on the issue. And where, Heather, where can they go to educate themselves? Like, I know Save Your Eye, safeeyecare.ca. Does that explain the issue as well?
It does. There's lots of information about the timeline in terms of how things got to this point, why we're fighting now. Yes, all
Okay,
these
so
things are
I'll
there.
put it on the different Facebook pages
Oh,
for the
thank you.
community, and I'll really push the fact that there's the petition, but also they need to educate themselves, inform themselves of how it will affect them, because
Yeah.
everyone looks at it as who cares? You know, if the optometrists don't get the money, who cares? But once they understand that it affects them directly,
Yeah.
not now, but for the future,
Mhm.
then I'm sure that people will wake up a lot more.
Absolutely, because it affects their parents, their grandparents,
That's right.
their aunts, their uncles, brothers, sisters. It affects everyone. Everyone needs glasses eventually, but everyone needs
Absolutely.
health care eventually. So yeah, it does. And I really hope people will look into the issue. And I think the more people that understand what's happening, the more people that get involved in the politics, and the more people that show up to vote in June,
Yes.
is the best way that we're going to get a government that cares, because right now we do not have one that cares.
That's right.
Absolutely, that's right. And I know that Susan just asked me from Facebook a question about what is your comments on the petition that Jim McDonnell tabled in the House yesterday. I wasn't in the House yesterday, so I don't know. I haven't seen it yet, but definitely I will be able to get back to you, Susan, maybe next week.
Mr. Hassan,
Heather,
you should
know
look
what
into it, because he tabled a petition from the Conservative Party basically saying that all the reasons why the optometrists were wrong, but it only looked like he had 2 signatures on his petition. And then something happened today where I think he was reprimanded for that petition. So it's worth looking into. It's very
Absolutely. So Susan, there you have the answer there. So what we have at the now is cohorts. 1 week, certain members will go to the legislature, and then the next week another. So I will be in the legislature this coming Monday and this week. So I'll be able to, if you have any petitions, please send to also on that to my office here or at the legislature, so I can table them as well.
I have a whole stack in my office. I can even drop them off.
Oh, that'll be great. Yeah, drop them, and then I'll be happy to also table them. And that's a shame, you know. Misrepresenting the reality is just not a leadership, in my opinion. You know, definitely we'll have an opportunity next year to an NDP government. Definitely we will move and implement these important eye care is health care. Absolutely. So I think we're coming to the conclusion of our time. Maybe I will start with Louisa for conclusion remarks, and then I'll come to Dr. Heather Shearer afterwards.
Petitions, petitions, petitions. The more that are in there, that they see that people really care, the more they may be a bit more concerned about this, because the election is next year. The more you make it a pain point for them, the better it is. So get out there, let's get the petitions in, let's get educated and informed about the issue, and let's just make it so difficult on them that they have no choice.
Yes, Dr. Heather.
I would just like to say, just to reiterate, it is saveeyecare.ca, and to thank you so much, Mr. Hassan, for inviting me and allowing me to discuss this really important issue. And like you said, healthcare, eye care is healthcare. So it is an important issue, and I hope more people get involved to understand the issue. Thank you so much.
Thank you to everyone for joining us this evening for this important discussion. Thank you to my guest, Dr. Heather Shear, optometrist, and of the Northwestern Eye Associates, and also my friend Luisa Giacometti. I'm sorry if I am mispronouncing your name, Giacometti, a local residents in our community. And we had also other members of our community who have agreed to join us tonight, but somehow could not make it. We also thank them as well. I have spoken to many optometrists over the last few weeks, and I know the decision to withdraw services is not taken lightly. They love their work and appreciate the opportunity to provide care that directly impacts so many in our community. Unfortunately, decades of government neglect and underfunding have forced them to take this action to avoid the risk of closing their doors permanently. For the sake of patients, the government must return to the table and strike a fair deal that respects optometrists and the work they do. We cannot ask patients to bear the brunt of this government inaction any longer. I will continue to use my time at the legislature to advocate and insist on an urgent resolution so that patients can continue to receive the optometry services they so desperately need. Thank you to each and every one of you, those who have joined us, and those also who have comments tonight, those who have joined on Facebook, Twitter, YouTube, LinkedIn, and thank you to Luisa Giacometti and also Dr. Heather Shear as well. Thank you for joining us. And folks, I'll be joining you shortly around 7 o'clock to also meet again and to talk about the important issues of the week. Until then, thank you.
Thank you so much.